Today we'll be discussing about scapular bone. Scapula in Latin means shoulder blade. First, coming to the costal surface of the scapula. The one which we are seeing is the costal surface of the scapula. Here we have three borders, which is the middle border, lateral border and superior border. Three angles: inferior angle, superior angle and lateral angle. We have two surfaces, the one which you are seeing the costal surface and the other behind it is the dorsal surface, and three processes: coracoid process, acromial process, and behind we have the spinous process. Coming to the costal surface, in the costal surface, this costal surface it's also called as subscapular fossa, and it is concave and it is marked by three longitudinal ridges, and another ridge is located along the lateral border. Coming to the borders, we have a superior border which is the shortest border, and near the root of the coracoid process we have suprascapular notch. The one which you have to remember near the superior angle is the suprascapular notch. And lateral border, this lateral border is thick, and here what we have to remember, near the upper end we have to remember it presents an infraglenoid tubercle. Superior border we have to remember suprascapular notch. In lateral border just remember infraglenoid tubercle. And medial border, it extends from, so it is thin and it extends from superior angle to the medial angle. Coming to the angles, here we have a superior angle. The muscle which we have to remember in the superior angle is the trapezius muscle, and this superior angle is covered by trapezius muscle. And inferior angle, the inferior angle here we have to remember one more muscle, that is latissimus dorsi muscle. Coming to the lateral angle, it's also called as glenoid angle, and it is broad. It bears the glenoid cavity or fossa, and which is directed forwards. The one which you have to remember here is the supraglenoid tubercle. It is present above the glenoid cavity. Coming to the processes, we have a coracoid process. It is an atavistic type of epiphysis, and we have an acromial process. Here we have to remember it has a facet for the clavicle. Coming to the dorsal surface. Coming to the one which you are seeing here is the dorsal surface. Dorsal surface, it gives attachment to the spine of the scapula. This divides the dorsal surface into smaller supraspinous fossa and larger infraspinous fossa. We have the other one which we have to remember is the spinous process. The spinous process, and it divides the dorsal surface of the scapula, as we told, into supraspinous and infraspinous fossa. The posterior border of the spinous process is called crest of the spine. Then coming to the muscles proper. Coming to the muscles. Now we will be learning about the muscular attachment. Coming to the muscular attachments. Coming to the muscular attachments along the costal surface. Muscular attachments along the costal surface, the one which we have to remember is the subscapularis. First we have to remember what we are seeing is the subscapularis fossa. The muscle which gets attached here is the subscapularis muscle, and it's a multipinnate muscle. It arises from the medial 2/3 of the subscapularis fossa. Then we have deltoid. We have a deltoid. It arises from the lateral border, lower border of the crest of the spine, from the lateral border of the acromion. It arises from the lateral border of the acromion. The acromial fibers are multipinnate. We have a subscapularis, which is multipinnate. We have a deltoid which arising from the acromial part, it is also multipinnate. Then we have serratus anterior muscle. The serratus anterior muscle is attached to the medial border of the costal surface. We have one digitation at the superior angle and two digitations to the medial border and 5 digitations to the inferior border, inferior angle at the inferior angle. Then we have long head of biceps. Long head of biceps, it arises from the supraglenoid tubercle. That's most important. Supraglenoid tubercle. Long biceps, we have a long head and short head. Long head arises from the supraglenoid tubercle and short head arises from the coracoid process tip. And coracobrachialis also arises from the tip of the coracoid process. So what are the muscles arising from the coracoid process tip? We have a short head of biceps and we have coracobrachialis, and this will be one of the questions. So two muscles arise from the tip of the coracoid process. We have coracobrachialis and short head of biceps muscle. Then we have the pectoralis minor muscle. The pectoralis minor muscle arises from the superior surface of the coracoid process. We have here superior surface of the coracoid process. Coming to long head of triceps. Long head of triceps arises from the infraglenoid tubercle. We have a long head of biceps arising from supraglenoid. We have a long head of triceps arising from the infraglenoid. It's very easy. Then we have inferior belly of homohyoid muscle. Inferior belly of homohyoid muscle, it arises from the near the superior border, near the superior border. We have near the suprascapular notch. Suprascapular notch. Near the suprascapular notch, we have this inferior belly of the homohyoid muscle. Then we have acromioclavicular joint. We have from the acromia, we have the margin of the facet on the medial aspect of the acromial process gives attachment to the capsule of the acromioclavicular joint. Super. Then we have coracoclavicular ligament. Coracoclavicular ligament is attached to the coracoid process. We have a coracoclavicular ligament which is attached to the coracoid process. This is the coracoclavicular ligament. Coming to the dorsal aspect. What are the muscles attached on the dorsal aspect? Dorsal aspect, we have a spinous process which divides dorsal surface into supraspinatus and infraspinatus. So as usual, we have a supraspinatus muscle. It arises from the medial 2/3 of the supraspinous fossa, including the upper surface of the spine. And we have infraspinatus arising from the medial 2/3 of the infraspinous fossa, including the lower surface of the spine. Very good. And coming to the trapezius muscle. This is the trapezius muscle. Trapezius muscle, it gets inserted into the upper border of the crust of the spine, into the medial border of the acromial process. Medial border of the acromial process. This is the acromion. To the spine, crust of the spine, then it extends to the, this is the crust of the spine, then it extends to the medial border of the acromial process. This is acromial process, this is the trapezius muscle. And then coming to the we have teres minor. Teres minor, this is the teres minor muscle. The teres minor arises by two slips from the upper 2/3 of the dorsal surface along the lateral border. Along the lateral border, by two slips it arises. The artery which lies between the two slips is the circumflex artery. Circumflex scapular artery. This is one of the viva questions. Between the two slips of the teres minor, we have an artery, that is the circumflex scapular artery. And then teres major, and it arises from the lower 2/3 of the dorsal aspect of the lateral border. Teres major. Then we have latissimus dorsi. It arises from the inferior angle. The levator scapulae. Coming to levator scapulae, it are inserted along the dorsal aspect, medial border, dorsal aspect, from the superior angle up to the root of the spine. We have rhomboides minor and rhomboides major. They also arise from the medial border. Opposite to the root of the spine arises the rhomboids minor and rhomboids major between the root of the spine and the inferior angle. Coming to coracoacromial ligament. Coracoacromial ligament we have is attached to the lateral border of the coracoid process and the medial aspect of the tip of the acromion. Then we have deltoid muscle. Deltoid muscle, we have a deltoid. It arises from the lower border of the upper border. We have trapezius. Here the lower border we have lower border of the crest of the spine into the medial border crest of the spine and from the lateral border of the acromion. Above we have trapezius, below we have deltoid muscle. Very good. Then coming to the superior aspect of the scapula. Coming to the superior aspect of the scapula. In superior aspect of the scapula, what we have to remember is the ligaments. One is the coracoacromial, another is the coracohumeral ligament. This coracoacromial ligament is attached to the this is the coracoacromial ligament. This is the acromial process. This is the coracoid process. Coracoacromial. So coracoacromial ligament. It is attached to the lateral border of the coracoid process and to the medial aspect of the tip of the acromial process. Okay. Coracoacromial ligament. So it's attached to the lateral border of the coracoid process and to the medial aspect of the tip of the acromial process. Then we have a coracohumeral ligament. This is the coracohumeral. Coracohumeral ligament. It's attached to the root of the coracoid process. We have a root of the coracoid process. So this is the acromion and this is the coracoid. So coracohumeral ligament we have, coracoacromial ligament we have. So then we have a transverse ligament. We have a transverse ligament which bridges the suprascapular notch and converts it into a foramen which transmits the suprascapular nerve. This is the suprascapular notch. It is covered by a transverse ligament. It transmits the suprascapular nerve and suprascapular vessels lie above the ligament. These vessels lie above the ligament. So this is the coracoid, this is the acromion. This is the spinous process. Here we have a acromion, here is the coracoid process. Then sphenoglenoid ligament, it bridges the sphenoglenoid notch and suprascapular vessels and nerves pass deep to it. So then coming to the ossification centers of the scapula. The scapula ossifies from one primary center and 7 secondary centers. Just remember, one primary center and 7 secondary centers. 1, 2, 3, 4, 5, 6, 7. And the primary centers appears near the glenoid cavity. Yes, during the 8th week of development. Very good. Then we have the first secondary center appears in the middle of the coracoid process. This is the coracoid process. From the middle of the coracoid process, the first one appears and fuses by 15th year. The subcoracoid center appears at the root of the coracoid. The subcoracoid, this is the subcoracoid. It appears at the 10th year and fuses around 16th to 18th year. The other centers include 2 for the acromion. We have a 2 for the acromion process and 2 for the acromial process and 1 for the lower 2/3 of the margin of the glenoid cavity. Very good. And 1 for the inferior angle. They appear around puberty and fuses around 25th year. The fact of practical importance is concerned with the acromial process, and if two centers appearing for acromial forces, the two centers in the acromial forces fails to unite, it may be interpreted as fracture on a radiological examination. Very good. In such cases, a radiograph of the opposite acromial process will mostly reveal similar fracture of union. So, importance of this centers is the centers which are present in the acromion. If these two centers they fail to unite, it may be interpreted as fracture. So, falsely interpreted as fracture if they don't unite. So, in such cases, take an radiograph of the opposite side, which almost reveals similar failure of union. So, normally clinical anatomy for scapula, what we have to remember is, normally if there is any paralysis of the serratus anterior which arises from the medial border, if there is any paralysis of serratus anterior muscle, it causes winging of scapula. What is this winging of scapula? The medial border of the bone becomes unduly prominent and arm cannot be abducted beyond 90 degree. The scaphoid scapula is a developmental anomaly in which the medial border is concave. Thanks.